Hello, guys. Good day. This is Andrew Free Enforcement Club. Today, we are going to talk about the recent outbreak of pertussis in the Philippines 2024. The Department of Health were able to notice that there was an outbreak in the Philippines, in the entire country. Really, it happened when they were able to note that there were 453 cases of whooping cough or pertussis were reported in the first 10 weeks of 2024. And we deeply lack of vaccination action to that matter. However, the Department of Health and the government, in the cooperation of the government of the Philippines, they were trying to order a huge amount of vaccines, 800 to 1 million vaccines coming this June 2024. Hopefully, it'll be earlier. Now, talking about pertussis or whooping cough, this is a highly contagious communicable disease caused by bacterium Bordetella pertussis. And usually the affected humans of this disease are children, infants, and they're going to be in a worse condition when they have this disease. And I am going to give you a quick description about the whooping cough later. Now, by the time that the DOH were able to know about this spreading outbreak of disease, which is supposed to be preventable, a couple of cities in the Philippines declared that they are in the state of calamity, invasion of this disease. The first one who claimed that they have an outbreak was Quezon City. So there were 25 cases reported and 5 deaths last March 21 of 2024. And the second 2 cities who followed to declare themselves as they were in the state of calamity from this disease were Iloilo and Cavite. And there were a couple of cases who were reported from these cities. Other than that, there were also a couple of cities who were infected by this disease, particularly Rizal, wherein there are 31 cases, Laguna 28 cases in March 25, Batangas 24 cases last March 25, that's only on March 25, Lucena City 2 cases March 25 of 2024, Taguig City 8 confirmed cases last March 24, Pasig City 25 cases as of March 22, and 17 confirmed cases and 2 deaths. That's only in the NCR, that's only in the Luzon. What about in Visayas and Mindanao? And there were also reported cases in Davao. So 52 pertussis cases in the first few months of 2024 in Davao region. That's in Mindanao as well in Visayas. Now, we talking about this pertussis, the first signs and symptoms of the first 2 weeks of this disease, unless if this disease really, this bacteria of like this Bordetella pertussis will invade the lungs as quick as it can. But, the initial signs and symptoms of this disease are mild cough, just mild cough, runny nose, low-grade fever, and sneezing. But by the time between 1 to 6 weeks, wherein the bacteria starts to really invade the lungs, the respiratory system, that is the start of the suffering of the infants, children, of the babies. They are going to experience an intense cough, high-pitched whoop sound during inhalation after coughing fits, a long duration of cough, and then when they try to inhale and then cough again in a period of duration. Now I'm going to show you later. And sometimes, because they find it hard to breathe after a long duration of coughing, they might vomit or they feel exhausted. And some infants may show cyanosis, lack of oxygen, because of a long duration of cough, and they try to keep up with the inhalation, try to inhale, they try to breathe, and then cough again in long duration. Now, even to the point of wherein they started to the gradual decrease of coughing, this will make them exhausted. And infants, the children, they are fighters. They will breathe as much as they can. They fight for their life. And it's not easy to see them experiencing this disease. So this is how a pertussis or a whooping cough sounds like on a child, on a little boy. Well, the good thing, although it's already there, the good thing about this disease is that this is quite preventable through vaccination. So make sure that your child is vaccinated from this disease, because as you can see, it's not easy to see them suffering, but it's already there. However, by the time that you got the vaccines ready, make sure to comply, to get your child vaccinated as soon as possible. Vaccination is one best way to prevent this. Think about it. This is totally preventable. And you can do this as a parent. You can prevent this not to happen at all. Just do the vaccination as soon as possible. Now, in terms of vaccination, I got this reference, the vaccination schedule. I got this from the National Immunization Program by the Philippine Pediatric Society, and I'm going to give you the link, on this video in my YouTube channel. So the vaccination is via intramuscular, minimum of 6 weeks old, and it consists of 3 primary series of doses at 4 weeks of interval. So 3 doses could be 6 weeks, and then I'll give you the schedule of the vaccination with 4 weeks interval, but it also varies on every pediatrician. You just have to comply this as much as possible, as much as you can, as soon as possible. So a series of 3 primary doses at 4 weeks interval, and 3 primary doses, and the 4th dose can be given at when the child is 12 months old to 23 months old, or 1 to 2 years. And the 5th dose will be given when the child will be 4 to 7 years of age. That is DTP, diphtheria, tetanus, and pertussis. And by the time when the child is 9 to 15 years old, he can get the Tdap, the tetanus, diphtheria, and pertussis vaccine boosters. Now, this is one best way to prevent pertussis or whooping cough. Vaccination. The second one is herd immunity. Herd immunity will only happen when there is already a large portion of people or children who are vaccinated in a community, and there will only be a small number of people who are susceptible. So the job of the nurses, the doctors, the healthcare officials is, their target is to vaccinate a large percentage of people in the community, and they're good to go. At least 80 to 90 or 90% of children and adults or young children vaccinated in the community. And that will help them out with the herd immunity. Otherwise, herd immunity can also happen if if the body can able to develop a resistance to the disease itself due to exposure. And one way to get that exposure is through vaccination, other than having the disease and then the body finally recover itself. And in the most part, by the time that you discover that your child has this disease, it's really important to keep the child isolated, because this is highly contagious. Otherwise, it will spread throughout as quick as it can. So infected individuals should be isolated in especially when they are in the contagious stage, where when they started to do that coughing, coughing in a long duration, and then with a sound as they breathe up, as they catch up to themselves to breathe, to live. And it's not easy to see this kind of patients. So when you see your child or any individual who is suspected to have this disease, completely isolated, because this is highly contagious. And once once there is a suspected individual, he must receive the right treatment by means of antibiotics, fluids, whatever the doctor may decide. And in the most part, once you have young children already, it's way better to get the booster doses. And that is one way to gain this herd immunity in communities. So please cooperate. We try to help each other. Comply. And this is a terrible disease, but completely preventable. Once again, so far, as of April 2020, April 23 of 2024, the trend of pertussis is still upward. And I'm going to show you the reference of this report. And the government, healthcare officials, healthcare workers, they are already gear up. It's just that they are still waiting for a huge number of vaccines. Hopefully it'll be earlier, but according to the report, it will come by June 2024. And as much as possible, beware and get to know about the disease, how to handle it, and how to prevent it. And if you ever feel like you're really in a suspicion that your child or any individual you may know that is having this disease, having the signs and symptoms of mild cough, runny nose, low-grade fever, sneezing, and intense high-pitch whooping sound of cough, high-pitch whoop sound during inhalation after coughing, it's way better to go to the nearest hospital and get yourself the right treatment. So let's work together, beware, and we can do this. This is Anne once again of Reinforce Me Club, and I appreciate your time. And you can follow me on YouTube, Facebook, Spotify, and Apple Podcasts. I appreciate your time. If you love this content today, this message today, please share it to your family and friends. Have a lovely day ahead. Thank you very much.